Yeah, that's the 2020 eradication plan. That's just a state report. That's due every year by law by March 15th. It's just another basic of what I did. Acres treated. We also do surveys, weed survey every year, and then so you get estimated acres of what we have. And then the other one is the 2021 management plan. I gave you a copy of that last time. That was basically an overview of what the program is, what we'll be doing this coming year.
Do we need a motion for this?
Mm-hmm.
I make
We need, yeah, for both.
For both of them?
Do you want to put it all in one?
Sure.
Okay.
I make a motion that we accept the annual noxious weed eradication program progress report and the 2021 annual noxious weed management plan.
A second. It's been moved and seconded that we adopt the eradication plan. All in favor say aye.
Aye.
Motion carries.
Yeah.
Do we need to say that for Todd to sign as well?
I just need two, don't you?
Just two?
I would accept one.
Would you?
Any signatures, but
There's no more signature pages on it.
no, just the
Okay.
front page as well. And I'll probably get started on chemical mode next week, weather looks favorable.
Yeah, looks like it's gonna
Monday,
stay.
so.
Yeah.
But then you got to stay above 50 and stay above 50 for a while, it looks like, so.
And things will be greening up before you know it.
Yes.
Good.
And that's kind of what probably start here early, just because it's one truck.
Yeah.
I'll finish probably a hair late. So.
So if it turned on super warm, then you'd be behind before you knew it.
Yeah.
So.
And in the spring, you know, with the wind,
Nope.
you just don't know
Yeah.
how many days it will spray. So
Yeah.
you just kind of get after it on the days you can. So. I say our conference is next week, but I opted out of going yet.
Yeah.
So
Where's it going to be at?
the Kansas Star Casino.
I'm not going to ours in May.
I still can't believe they're having it, to be honest with you.
I'm just shocked they're having ours too. But I'm not.
We have 65 counties attending and 10 Zooming.
Really?
Because we have 14 speakers, and 9 of the 14 are Zoom. And so it was just kind of, and we had an option to put it off till July, and we do a summer training. They didn't want to. So. But to that, well, I volunteered Cindy to be in charge of registration.
So she has to go?
No, we're not going. We let them know we're not going right away. But been emailing all these counties since the beginning of the year saying, because we told we weren't going to go, so we said we need to have the registrations in so we can mail meal tickets, receipts out before the conference. Just got another registration today. A guy called today. Oh, I kind of lost track of time.
Yeah.
Like, it starts Monday. You do know it starts Monday, right?
Yes.
Yeah, I just lost track of time. Can I still register? Like, well, yeah. It's just kind of amazing to me that, you run the car.
Yeah.
But yeah, other than that, you guys have any questions? Or?
You'll probably be going to the casino rather than the meetings anyway.
Oh, no, I know there'll be a lot of them. Yeah. All right.
I'm good. Thanks, Ryan.
Thank you.
I make a motion that we approve the minutes of the February 17th, 2021 meeting.
Second. It's been moved and seconded. We accept the minutes of February 17th. All in favor say aye.
Aye.
Aye. Motion carried. We'll go into executive session.
I think she is, yeah.
Yeah, she is.
You're going to executive You don't have, last time we did, I mean, I had
okay.
the job description.
Okay.
I mean,
No,
Yeah.
it's fine.
Yeah,
if you
unless
guys
you
have
want-
comments, we should, but
Yeah.
if you're just gonna look at them and sign off on them.
Right. Okay.
She wants to, she may want to.
I guess we can ask her if she wants.
Yeah, if she would feel more comfortable, by all means.
Kara, we'll recess for a couple of minutes. Let me sign this.
So I've got employee evaluations for Katie and Emily. Over this past year, I feel like they've both done an exceptional job, especially the circumstances. They've both done really well with trying to remain positive, even though we've had lots of angry phone calls and such.
Has that died down a little?
Yes, we're actually getting lots of positive feedback currently because of vaccinations, so that's been nice, a nice change. I mean, we still do get occasional angry phone calls, but they're getting far in between.
Good.
Emily, whenever I was off on maternity leave, she had learned how to do the billing system, so she kept that up while I was off. Kaylee jumped in and helped her do case investigations, data collection, and contact tracing, which was really helpful. So they're both very willing to jump in and do things that they don't always typically do, and it works really nicely. Keeps things going smoothly.
Yeah. How's things going with the COVID vaccination?
Really good. So we have vaccinated, I think what I looked up yesterday was 639 people. 60 of those are second doses. So 60 people in the county have had 2 doses and are finished. We're going to do another group of 100 this Friday.
First doses?
First doses. And then beginning in March, we'll have clinics of second doses. So the first week that we do them in March will be a group of 100 first doses. The second week will be a group of 300 doses. The following week, I think, will be 100, and then another week after that will be 100, just because of the way that the vaccine shipments fell.
But we're getting more vaccine currently than you originally thought,
So
right?
we had a shipping delay because of the weather. So we were going to, last week we were going to do 200 doses and we only had 100 to do because we didn't get the shipment that we expected. So that's why we're doing another 100 this week because the shipment finally showed up this week. I got told last week that we got put on pause for getting initial doses shipped to us because they went per capita for each county, and we have received more doses per capita for phase 2 than a lot of other counties. So they paused us to divert our first doses to the bigger counties so that they can catch up on their phase 2 populations. So at least for a week or 2, we won't receive any initial doses. We'll still be receiving our boost doses, so that people that have already gotten their first ones will get their second doses. They're supposed to send us an email to let us know whenever they're going to unpause us and start shipping us more doses, but it sounded like it was only going to be like a week or 2 time frame. So we aren't going to get any more the rest of this week with our first doses, or probably next week, but then maybe the following week we'll get some more first doses for people.
How many more phase 2 people do we have that are signed up?
We thought we would probably get through phase 2 with this group of 100 that we've got, but we keep getting phone calls adding on to it. So right about the time we think we're going to be finished up, we'll get a couple more people that add on to phase 2, but with that happening, if we've already got a schedule done, we're leaving it set how we've got it and then catching people later. And I mean, we've even had some phase 1 people call and say they want a vaccine because they've changed their mind, and we add them in there and make sure they're still. So,
We're getting pretty close to knocking phase 2 out.
yes, yeah.
And then, is it the state's decision when you go to phase 3, or just whenever we're done with phase 2?
Whenever we're done with phase
we
2,
can go to phase
move on
3.
to phase 3.
But realistically, we probably won't get a ton of first doses until everyone else is caught up on phase 2. Because they're not gonna send us phase 3 doses if, you
No.
know, bigger counties are still on phase 2.
Right.
Yeah.
And I mean, whenever, so last week, whenever we thought we were gonna do 200 doses, we really thought we would get through phase 2 and be able to catch some of the phase 3 people and have them come on it too.
Mhm.
So, since that didn't work out, we didn't get all the doses we thought we were gonna get. We did a bunch of phase 2 people, and then we're calling and scheduling for this next clinic. And the majority of them are gonna be phase 2, but there are gonna be a handful of phase 3 that get called just because
Yeah.
we've already called them, and then we have phase 2 people call and say that they want on the list, and so we schedule them as they
Yeah.
call whenever we've got stuff open.
Well, that's good that we got phase 2 done though, because that's your high risk
Yes,
population.
yeah.
So-
And I know the nursing homes signed up for the federal distribution, and they've all been fully vaccinated. All of the residents of the nursing homes have, so that's good too.
Didn't we at one time have 850 on the list, or did I dream that number?
We did at one point. I don't know what we're at right now, just because I didn't ask Kaylee, since she was
Yeah.
still calling and scheduling and making
Okay.
appointment
Yeah.
times for people. I know it's gone up, because, I mean, I've taken phone calls and taken information down and put people on our wait list, so I know it's gone up.
Yeah.
So really, we need about 3,000 people vaccinated
To get her.
to get to the,
Yeah.
to get to the 75 to 80%.
Our active case numbers have gone way down. I think right now we've only got 2.
Is that, do you suspect that from lack of testing, or? I didn't know if we really had it whipped, or if.
I truly think, in my personal opinion, it's probably a lack of testing due to people thinking it's just a cold,
Yeah.
it's just
Allergies,
allergies, or they just don't want to go get tested.
Mhm.
And a lot of the case investigations over the last couple of months, whenever they do finally go get tested, consistently the response has been, well, I just thought it was a cold, but then I lost my taste and smell.
Yeah.
So it's really hard to differentiate between it being a
Yeah.
cold or allergies or influenza or COVID right now.
And rightfully so, because
Yes.
just because COVID's here doesn't mean that all the other stuff.
Exactly,
leaves.
because there have been people that have gone and
Yeah.
tested because they were afraid that it was COVID and it's just a cold.
Yeah.
So
Yeah.
it's really difficult for people to know when it's appropriate to go test and when it's not. And I feel like that's just gonna be the case, because I don't think COVID's going anywhere. It's been here for a
It's gonna
literal
be a
year.
while.
Yeah.
So it's gonna be a figure out how to live with it thing.
Yeah.
I think now. But yeah, so our case numbers are down, but I think it's due to lack of testing, and that's just, I think,
Yeah.
it's probably the same way everywhere,
Mhm.
because everybody's doing that. I don't know if it's just a cold or allergies thing, so.
I feel that, and I have no basis on, but I feel that the influenza and the common cold occurrence is less this year
It
than
is.
has been in the past. And I think
Yes.
it's due mainly to masking and distancing and,
Yes, I agree. We haven't had nearly as many influenza cases as we typically do, and I really think that's because people are wearing masks whenever they're out in public places. They're more attuned to hand sanitizing, washing hands using hand sanitizer. There's a lot more cleaning going on, especially in public places. I think it has really knocked the influenza numbers down because of all of those things.
Mhm.
Yeah, because I think we've only been told about 2 or 3 in our county, so, and
Yeah.
that's way less than we typically see. And we didn't even get flu vaccines out as well as we typically do either, due to people not really wanting to come out whenever flu vaccines were out. We still have them and we can still give them, but, yeah. I'm finishing up grants. I'm doing a family planning grant, maternal and child health, emergency preparedness, our state formula, immunizations, and then they just let us know that there's more funding for COVID available, and it's a non-competitive grant. Each county's given an allotment, and you can apply for all of it or just some of it. I'm still looking through it to see what is allowable expenditures for that one, to know how much to ask for that one. But it's, it goes through 2023. The funding does, so.
As far as COVID-related stuff, is there anything like on the wish list that you think that you need? You know, say you get a COVID grant and it says you can only spend it on COVID-related stuff. What, I mean, what would we?
So the first one we got, I used that for staff overtime, so for some cleaning supplies and PPE that we didn't have an abundance of. We used it for like the postage to ship specimens that we collected, especially like whenever we did the testing at the nursing homes and had a bulk of stuff. I mean, those couple of times that we did that, we spent over $100 on shipping because it had to be overnighted. So it would probably be similar things. It would be nice to be able to help the hospital out with testing probably. I mean, especially once we kind of level out on vaccine distribution and we aren't quite as busy. I know the funding can go towards that. I know that's one of the things that's on there. So I don't know how much, I mean, we can ship the specimens to the state still. I know that they've got rapid testing supplies and stuff available, but I don't know how much that kind of thing costs. I'll have to do some research on that.
Yeah.
But I don't know what all this grant will allow us to spend towards. So I'll have to do more research on it because they just did tell us about it. So, and it has to be turned in at the same time as all the other grants, which is the 15th of March. So.
I wonder if you could do mobile vaccination day.
I'll have to, like I said, I'll have to look and see if it's allowable with the grant.
Because we have the refrigerator and all that to fit.
We also were given tents for drive-through anything.
Yeah.
So they're big tents that a car can drive through.
What?
The state sent to us. We got 2 of them.
Really?
Yeah. But I wasn't really keen on the idea with it being -20 outside.
I've heard just from different people around that have been phase 2 vaccinated here, and then heard from people in Barton County, it's overwhelmingly positive to our system versus drive-through, which I mean, their demographic is a lot different. They might not be able to do what we're doing, but just, it is what it is, and people are liking our system way more than, I mean, I've heard more stories of people sleeping overnight in Barton County to try to get it
and we've had people from Barton County call and say, can you please be on your wait list because I can't sit in my car overnight.
People have waited, 5-6 hours.
Yes.
And then got the shot, but they literally spent all day waiting in their car.
Right, yeah.
So.
And then I feel like it's probably gonna be the same circumstance for their second dose also.
Yeah. But
their population is much larger than ours, and it's probably time consuming how they're already doing it, and I don't know how they're doing the best with what they're able.
I've had several people tell me that they're sure glad that they're here and able to make an appointment and go in real fast and do it. And it's quick and easy.
It's worked really nicely. I was nervous the first one that we did, just because I didn't know
Well,
what
that's
to expect.
understandable.
But it went really smoothly,
Yeah.
and I mean, yeah. It's a lot of work having to call and schedule all the people.
Oh, yeah.
But I feel like in the end, it's worth the time
Mhm.
to do it that way. That way we know we've got people coming in, it's easier for them, like you said, they can come in, get their shot, and get out within half an hour.
Yeah,
So, instead of taking all day. So, and we figured out after the first one that we can do more people in a shorter time frame.
mhm.
So it was a learning curve on the first one, but it was a positive thing versus we had something really big to change.
Yes.
It was something that was an easy adjustment to make, so.
Yeah.
Well, and I think at the lodge, since it was large enough that, spacing wasn't a problem.
Right. The day that we do 300 is going to be more of a challenge for the spacing and making sure we've got enough chairs for everybody set up and all of that. But for the days that we did 200 and 100, it was no big deal. So, yeah. And we kind of worked the system out with the people that are not able to walk that far to get them their vaccine in their car so they don't have to walk in, so. Oh, the state added, so we have 24 hours to put the vaccines into the state reporting system after we've administered them. We have to report daily to the federal CDC for the vaccine that we have available. And the state added another report that we have to do Monday through Friday of what we've got in stock and how many we've given also. Because their reporting systems have a breakdown, I guess, and they're not seeing all of the vaccines that have been distributed. So I'm hoping that this last one that they want us to do Monday through Friday will only be for a brief period until they get figured out what the issue is, because it takes time to do all of those reporting.
Yeah.
And yeah, it's just a lot at one time to do all of that and then everything else, so.
Yeah.
Anyway,
Okay.
I think that's all I've got.
Keep up the
Keep
good
up
work.
the good work,
Thank you.
yeah.
You guys have a good day?
Yep, you too. See ya.
Oh, Shannon, here's your accounts payable stuff. Thanks, Kaylee, a trip.
Thank you.
We ready for executive session?
Yeah.
Like, I make a motion that we go into a 5-minute executive session, including the commissioners, Nita and Mike.
Second. It's been moved and seconded, we go into executive session for attorney-client privilege. All in favor say aye.
Aye.
Aye. Motion carried. Carolyn, do you have something?
I don't really have anything.
You know?
I did change the date for the hearing for the Port Authority because John and I miscommunicated on the 30-day requirement after publication. So anyway, rescheduled for April 21, the same format of here before the regular commission meeting.
Okay.
So I just guess I would confirm with Nita that the room.
What day do you have it on?
April 21,
Oh, 21.
Wednesday, right?
It'll just be at, 8 a.m.
8 a.m. We're going to fulfill the requirement of having a public hearing on the plan for development.
Yeah.
That's the Port Authority.
Correct.
So the board, the commissioner board doesn't care. Okay. I mean, I don't care, isn't it? Yeah.
Yeah. We'll open it up as Port Authority. If anybody shows up,
Huh?
You don't have
they can show up.
I know, but I'm gonna put it on the commission agenda, but it's not commission,
Should be able to
not put it on.
Just
Directly do
Because I
it,
don't want you.
Yeah.
nice and short and sweet, I
We're
hope.
gonna get-
Yeah, I would say so.
So,
Okay,
okay,
that'll work.
sounds good, thank you. This is a piece of mail that came to us. I don't know if it's
Julie,
junk
do you have
mail
anything?
or real.
No?
Oh, last week we had problems with the phone system and the alarm went off over here. Yeah, that's probably what this is.
Johnson Controls. Sounds
Yeah.
like alarm system.
Yeah, it was, I don't know.
Okay. We opened it because it wasn't.
No, that's
addressed
fine,
correctly.
that's fine. If you get the bill, you could pay for that too.
Okay, anything else, Nita?
I don't have anything.
Well, adjourned, Carol.